Hi, and welcome to Healthy Living. We are here today at Coastal Carolina Hospital, Novant Health. We're really excited. This is our first show with Novant, so we're thrilled. And my friend, Dr. ATD, Dr. Tolbert. I mean, it's so good to see you. It really is.
Yes.
I feel very fortunate. We had the honor of speaking together once, and it was absolutely inspiring. And everyone came up, Dr. TD, Dr. TD, Dr. TD. You were like the hit of the entire thing. So thank you for joining us here today.
Sure.
You are with Riverside.
I am.
And you have some really fun news to talk about the practice and things that you're doing here at Coastal Carolina Women's Center.
Yes. So we have introduced as an alternative for pain management in labor, nitrous oxide.
Oh, nitrous oxide?
Nitrous oxide. So the gas that you can inhale, it was or has been traditionally called laughing gas.
Yes.
It doesn't really make our laboring patients laugh.
No.
But it definitely takes away a lot of the pain of labor.
You know, I'm so curious about that. Do you think it's pain, stress, the anxiety of it? It just sort of lowers that stress level?
Well, it definitely helps kind of lower the stress, but it has been shown to help with the pain fibers of labor.
Oh, that's amazing.
It's been used for a few decades in other countries, and in the U.S. recently it was approved by the Food and Drug Administration.
How exactly does that work? A young woman comes in to have a baby. I'm assuming you've talked to her ahead of time about kind of options. Does she want an epidural, do natural, whatever?
Right.
Talk to me about the decision to make that and what goes into that, and then what they can expect.
Right. So the decision is ever evolving.
Okay.
Especially if it's a first-time mom who's not knowing what to expect
Correct.
for pain. And so it's introduced and offered to all of our patients. It is readily available whenever they need it. Mm-hmm. It is administered by way of a mask.
Oh.
The patient holds the mask herself. And if she's getting really kind of sleepy or tired, then usually the mask will fall away.
Okay.
So no one's kind of keeping it there and over-medicating her, so she's getting what she needs when she needs it.
I like that. What I hear
Right.
you say is I basically have agency over myself.
Correct.
Which is amazing. Okay. And
correct. And the onset is pretty quick,
Okay.
and it also goes away pretty quickly. So it's not something that lingers.
Has a lot of residual.
Or stays in the system. The biggest challenge is just getting our patients used to knowing when to use it.
Right. Okay.
So it takes about 30 seconds to begin to kick in.
Okay.
So ideally, they should start breathing it before they hit the peak of their contraction.
So really, there's a learning curve to it too.
Correct.
We can educate.
Correct. But it's quick. It's pretty quick.
Tell me about baby and mom safety. I know
Yes.
you're a safety young woman here.
Yep. So safety is always our priority. And so this medicine does cross the placenta.
Okay.
So baby is exposed to it, but very low volume, and it gets out of mom and baby very quickly. So before we started using nitrous, we had IV medication for pain as an alternative for pain management.
Okay.
The IV medicine hangs around a little longer. It makes the baby a little sleepier. Mm-hmm. If a mom's getting really close to delivery, the IV pain medicine is no longer administered because of the longer term effect on the baby. Whereas with the nitrous, you can use it up until the baby's born.
I mean, that's got to be exciting for you.
It is.
I mean, always evolving. I know we're going to take a quick break, and we're going to come right back. And we've got more to talk about when it comes to this topic, so stay with us. We'll be right back here on Healthy Living.